Hello, Dr. Mark Contos here with iTube Daily Coverage in Chicago. And with me today is Dr. John Kanellopoulos. And Dr. Kanellopoulos is the head of the Kanellopoulos Vision Institute in Athens, Greece. And we're going to talk a little bit about cross-linking and some of the customization that he's been able to do in his clinic and how that's really been able to affect treatments for refractive error as well. John, thanks for joining me today. I really appreciate having the opportunity to talk with you a little bit because we're talking about something that I had the opportunity really to watch you do. It was, really a great thrill for me to be able to spend some time in your practice and see some of these treatments that you're doing, especially in the cross-linking area and some of these customizations that you've developed. Talk a little bit about that and some of the results that you've been experiencing.
Yes, thank you, Mark, for having me. First of all, it's always a pleasure to be here. We are very excited about pushing the envelope of cross-linking even a step further. We're working with Vidro's KXL2 device and on two different fronts. The one front is using the device as a standalone refractive corrective means. So this is pixel photorefractive cross-linking, and by adjusting variable fluence within our treatment, so this is a treatment that in certain areas of the cornea delivers energy as high as 12 joules, and this is about 2.5, the classic Dresden protocol, and in other areas of the cornea, no UV light. So this differential appears to create a refractive effect that's predictable, and it's very excimer-like. So we have now 14 months follow-up from cases that we treated for hyperopia. These could be also considered presby-Lasik cases, myopia, and toric cases, astigmatism. And we get about 1 to 2 diopters correction that appears to be stable during this period.
Well, and you've been able to show that by doing that, you can reduce, what needs to be done for the refractive component of the laser treatment, thereafter, and that's kind of an important aspect of this whole thing.
Exactly. We also use it on a second setting in conjunction with topography-guided normalization in keratoconic eyes, and by using pixel in those eyes, we're able to reduce the ablation needed, which is always a difficult thing to do in corneas that are thinner. So I think the data that we have on that is very impressive, and having a little bit more experience in time, I think we can create a new paradigm on this.
Yeah, you've got kind of some more longer-term results now with this. I know you remember when you first started talking about it, and now it's been that much further, and it still seems to be holding true. It looks like that the data supports that this is really a viable option.
Yes, we're past a year, and I think that the refractive component of CXL, spearheaded by Vidro internationally, this is CE marked since about a year ago, October of 13, addresses a very large part of the population, can address theoretically all the post-cataract cases that need some fine-tuning in the refraction without having to remove tissue,
right.
And can address all those patients that we feel in everyday practice that maybe your refraction is not large enough to mandate a LASIK procedure, for instance, a minus 0.75, or a patient who has against the rule slight astigmatism. So all these patients become potential candidates for this technique, and it's very minimally invasive. Most of these procedures are epi-on.
Yeah, and it sounds like there's really a lot more you can go with this. I mean, you're really kind of just starting to look at what this can do for you, and there's probably a lot of other avenues you can pursue with this as you go forward.
Exactly. I mean, the area of customization is unlimited. One can theoretically employ this in a patient who already had refractive surgery to adjust their asphericity, because this is so customizable. I think it's a door to a really new world in using cross-linking beyond its stabilizing ectasia, but using it as a means to manipulate the biomechanical behavior of the cornea and slightly tweak its refractive properties.
Yeah, well, it's groundbreaking work, and it's real interesting to get your perspective on it and how kind of this update on where it's at right now, and it looks like it's promising and going to continue to be so. Really appreciate you taking the time to visit with me on it, and it's real interesting.
Sure, I thank you very much. We're very excited about it.
Yeah, great.